With this, I would like to now turn this over to Dr. Michelle Rowe, who will introduce our speaker. And hopefully all of our house staff, fellows, students listening are inspired a little bit by what you can achieve. So Michelle.
All right, good morning, everyone. And it's my pleasure to introduce our speaker today, Dr. Allison Eddy. And she's going to be speaking on the importance of academic mentoring in a career. And this is such an important topic for today because both Blanche and Alfie have been really, really important mentors for me throughout my career. Dr. Eddy completed her MD degree at McMaster University in Hamilton, Ontario, and did her residency in pediatrics at McGill before moving south to Minneapolis, where she did her pediatric nephrology fellowship. After that, she had positions at Sick Kids in Toronto and was division chief of nephrology at Seattle Children's before moving to University of British Columbia to be chair of pediatrics. And she recently completed a tenure as chair of pediatrics there and will now be moving on to the next phase of her career. Her research focus has been in mechanisms of kidney fibrosis. So Dr. Eddy, we're looking forward to your talk.
So thanks very much, Michelle. It's so great to be with you on this very special day. I hope the audio is okay. So I've spent the last 10 years at this institution, BC Children's Hospital, our lovely new hospital from 2017, and University of British Columbia. And it has become the tradition in Canada as we attempt to travel the journey of truth and reconciliation with our Indigenous people. I'd like to start by acknowledging the land on which I'm speaking today. I have moved from Vancouver across the country to Ottawa now, and today I'm speaking to you from the traditional, unceded, and unsurrendered territory of the Anishinaabe Algonquin people. I have nothing to disclose, and again, a heartfelt congratulations to two of my fellowship mentors, Blanche and Alfie. Really a very wonderful recognition of your accomplishments throughout your brilliant careers, and I'm so lucky to have been a receiver of some of your teachings. So when it was suggested I talked about mentorship, I sort of had this response, like a word cloud. It's like, where do you take this conversation? Something we all talk about, we all believe in, but there's so much to it. So I've identified three goals for today and hopefully take you through a bit of a journey. I've chosen to focus on the importance of mentorship from early career to end of career as an academic. Oh, it's not necessarily an academic, but as a pediatrician primarily affiliated with an academic center. But a lot of what I say applies abroad to a lot of different career pathways as well. So it's always good to begin with a definition, and I really would say there's not an ideal definition. I'm just going to highlight a few keywords from two of them that underscore a couple of principles. It's a protected relationship in which a more knowledgeable or experienced person guides and nurtures the professional development or growth outside the normal reporting relationship. It's not this power hierarchy, it's a different type of relationship. And its focus goes beyond specific competencies or tasks to build a climate of trust so that the mentee can feel secure to seek advice on issues impacting professional, and I've added personal success. I do like the second definition as well. It's to support and encourage people to manage their own learnings in order that they may maximize their potential, develop their skills, improve their performance, and become the person they want to be. So I hope I will convince you in the next several minutes that mentorship does matter. And I'm going to give you two overview slides. First of all, some of the key messages. And then I actually went back to the literature. I mean, as we're all scholarly faculty, it's what's the evidence? Maybe this doesn't matter at all. What's the best way of doing it? What can we learn from the literature? And it's actually quite a bit out there. So here's the key messages, and then I'm going to show you some of the evidence. So mentorship is certainly not new. It's been espoused as a value for decades. Although surprisingly well-structured, sustainable models that have been evaluated and in terms of outcomes are still quite rare. Good mentorship, however, is challenging on many levels. First, it's finding a mentor and committing to this relationship is hard work. It's often still done off the side of your desk. Traditional emphasis of mentorship programs has often been on research output, but not so much on other career goals, and that is changing. And I want to underpin that career mentorship is quite different than the relationship you have with a research supervisor. And if you ask, the majority of faculty in North American medical schools report that mentorship is infrequent and or inadequate. I would suggest that the gold standard traditional model is still the one that's most extensively studied, but new models are emerging, and that is the classic dyadic, or two people in a hierarchy, the more experienced and the less experienced. And there is actually published evidence that such relationships are of benefit, especially in areas of improved scholarship, promotion, and retention. However, I think there's been a bit of a renewed interest, maybe even a renaissance of mentorship to address existing and newly acknowledged challenges. Certainly in terms of addressing systemic gaps to improve equity, diversity, and inclusiveness, the dwindling pediatrician scientist pipeline, faculty retention, physician leadership, physician wellness and burnout prevention, and heaven knows the healing after the current pandemic. And it should be something that we nurture and value throughout the career journey. New mentorship models have gained popularity and may even be more effective in certain objectives. And I've just shown over here sort of 7 different types of mentorship structures that have been identified. Also, the idea of sponsorship evolving from a mentorship relationship, and more recently, the concept of allyship. There's an appreciation of generational differences, a great topic we could spend some time on. For example, what is the most effective way to mentor millennials? Increasingly important is placing value and acceptance on personal as well as career goals and the construct of work-life integration. Physician wellness and preventing burnout is a top priority. In fact, mentorship is really essential to help prevent burnout. It's important that as I mentioned, it goes across the career span. As someone facing the transition to retirement myself, I think this is probably the one part of the journey that's not well done, and it should be. I would also suggest that rarely can only one mentor ever give you everything you need to grow. So there's some challenges here. We can and must do a better job of mentoring across all career stages. But my challenge to you is don't blame the system. Start with what we can influence. I liked this slide to sort of be underpinning my key message today as we all struggle with physician burnout and how to maintain wellness. I really like this study, and I've not seen it duplicated anyplace else. It came out from the Mayo Clinic more than a decade ago, surveying internal medicine faculty and surveying whether there was a degree to which there was a feeling of burnout, and the idea of how much time during your day, your week, your month do you get to spend doing what you enjoy, what work you would consider meaningful. And it turned out that as long as you could say that you spent 20% of your time doing those things, that the risk of developing burnout was less than half. And this was, as I said, a decade ago. I bet these numbers would be quite different now. And interestingly, from this study, almost 70% thought that patient care was most meaningful to them, 19% research, 9% education, and 3% administration. And it was actually the education group that found it most challenging to get to that 20% mark. And so my point is, this isn't really a very high bar, but the data suggests if we can get to this, that would be a great way of keeping ourselves well. And there's actually been some studies to look at burnout impact for early career academic physicians. This tended to be more physician scientists. This is a study from Japan. And they found that burnout was slightly higher in women. It was lower in those that had a mentor, and it was lower in those who had a role model. Talking about the need to integrate work-life integration, I would say most of us might feel a little incompetent to be serving the mentor role for junior faculty on how to do this best. And I thought this was an interesting study that came out of Columbus, where they actually developed a training module for mentors to help them be better mentors in terms of working the work-life integration. And almost all faculty found that this module very, very helpful. For my next few slides, next several slides, I'm going to break probably every rule of how to perform good PowerPoint slides. I've prepared this as a bit of a syllabus for you, and I'm going to introduce you on this slide into the format. I've chosen to really embed my comments in the literature. And so each gray box highlights a publication really published in the recent years. The title of the paper is either in the gray bar or up in the top. And I've bolded the key messages that come from each of these studies. And so I know they're a bit busy, so I'll just highlight the bolded part for you. And then you can have this as a syllabus should you want to go back to the literature. So thankfully, the literature is growing. When I searched in PubMed under physician and mentorship, this is what's rapidly happening. But even more encouraging is shown in the red bars. So if you look at physician mentorship and outcomes, there's an increasing body of evidence to show outcomes are benefited when you have a structured mentorship program. I like these two papers that were the summary of award presentations given for major national awards that focused on reflections on good mentors. The first on the left was the Joe St. Jim's Award in 2018. Now, this is a leadership award. Dr. Schuster chose to speak on mentorship. And he noted that a good mentor is someone you feel comfortable with, looks out for your best interests, is accessible, direct, is forgiving, and doesn't have to be perfect, and understands you and your needs. The second award was an APA, actually a National Mentorship Award. And Dr. Serwint said her lessons from her mentors were, have the courage to share constructive feedback to empower people to reach their potential, strive for excellence and provide support to achieve, lead with respect, kindness, collegiality, and grace, care about individuals' well-being, humility. This is one's important, to know that the mentee has their own inner wisdom. Mentor needs to provide guidance to find that wisdom and lead an authentic life. Really all profound words. Really like this paper as well, though. It's the only one I've really seen quite like this. And that is a playbook for the mentee, because mentees have a major ownership of this process and some significant responsibilities. And a mentee checklist and sort of how you get started. Do some prep work. Find a mentor or maybe two. Think about things to look for in a mentor. The first meeting, what you want to come away from with after that meeting, taking an active role in cultivating the mentor-mentee relationship, and realizing that it's not forever, these relationships, mostly, and what separation looked like. It's back to the goals of the actual mentorship relationship. I like this. So I'm going to be introducing you to some new twists on the classical dyadic mentorship relationship. And I like this one. This has to do more with academic and research trajectory, but more of a team-based effort, which is named Scholarly Collaboration, Mentorship, and Friendships, a new model for success in academic medicine. And what they, again, a note that it can be very challenging to find a good mentorship relationship. One of the key principles for this is to have overarching shared research goals. So it's more of a partnership than hierarchical. It's really important to have structured, regular meetings and to focus on the human connection. This is an interesting study from Stanford where they had a mentorship program for junior faculty, and they did surveys annually to see how it was going. And in quotation, you'll see, I think, a truth. Competing demands can undermine confidence in the value of an academic career. But the add-on of a meaningful mentorship structure is it bolsters satisfaction and enhances faculty retention. And I'd like to underscore, regardless of career pathway, you don't have to be a pediatrician scientist. It's felt that you should meet at least twice annually. And the purpose is to build on this and establish this mentoring relationship. And at the end of each meeting, identify next steps. found to be helpful so that the dialogue can continue over time. Mentees themselves found workshops to be especially valued in terms of their own career development, and facilitated peer group mentoring, which I'll talk a little bit about, is, I think, growing in popularity. This is an interesting systematic review. It looked at 16 articles that met adequate criteria. And the key findings from this were, again, they came up with the 7 different models of mentorship, but at the time, the dyadic form was most common. In terms of topics discussed, formation of the mentor-mentee pairs received a lot of attention. Mentees clearly favored choosing their own mentors. And this is an important take-home message today. Actually, written agreements were important to set limits and encourage accountability. None of the studies have had any follow-up in terms of long-term outcome. The outputs are pretty short-term. With the interest in trying the gap in number of women who are not just in academic medicine, but promoted through the senior ranks and into leadership roles, mentorship has become one construct for trying to improve that gap. And this was a mentoring program in which they evaluated both the mentor and the mentee. They started the program in 2010, and this was an analysis at 2015. They noted that career development, research, promotion were topics were most discussed. Conversation about mentee professional development and well-being were felt to be the most helpful. And impact is on the same areas I talked about before, but now you see for the first time an impact on invited presentations, membership in professional organizations. And this introduces the concept of sponsorship, which is, I think, an additional element of the role of these relationships. This is another sort of fun one, the hashtag women in medicine perspective, the women mentorship relationship, and what they came up with as advice for the mentors is, as a mentor, acknowledge your own strengths and limitations. We all suffer a little bit from this imposter syndrome and having to be better than we think we are in different roles. Again, importance of talking about work-life integration. Help the mentee set some long-term career goals and act as a sponsor was actually called out. And I just mentioned one other systematic review that was focused on the efforts to improve efforts with women mentorship. And it didn't really impact outcomes whether the gender of the mentor was concordant or not. Underrepresented physicians in academic medicine, another really important area that we're trying to address, long overdue. This was another systematic review looking at specifically underrepresented physicians and trainees. At the time of the study, dyadic relationship model was still most common, that one-on-one, but several novel models had been described. Again, there were objective outcomes of benefit. They called out the importance of institutional support, which will be the ideal state I'll come to. And they noted that there was value including both mentors underrepresented and non-underrepresented mentors in these programs. So mentorship is not enough. I kind of alluded to this, but the exploring sponsorship and its role in career advancement in academic medicine. Unlike mentorship, sponsorship is episodic and focused on specific opportunities. Mentors certainly can and should be sponsors. Truthfully, sponsors are career established and well-established, I'd say well-connected talent scouts. Effective mentors are mentees, or some people refer to them as proteges, rise to the task and remain very loyal for these opportunities. But it's really important to be able to comfortably weigh the risks of an opportunity being presented to you and that many benefits versus potential risks. But successful proteges demonstrate potential and make the most out of career enhancing opportunities. I want to move a little bit now into peer mentorship, because in a way, I think this is starting more and more as grassroots initiatives, has some real advantages. Seeing more of it in professional organizations. And I think this really can be very powerful. It takes, so a couple of sort of descriptors, it takes place between a person who has lived through an experience and a person who is new to that experience. Tend to be close in age experience and education level. And what's helpful is there's at no perceived or real power differential. And so for many people, this is a more comfortable mentoring environment. It offers higher degree of mutual bilateral assistance. So both the mentor and mentee benefit. Growing in popularity is the use of small peer groups for mentorship. 7 to 10 people is popular. I would say the literature on this is understudied to date, but it has some unique strengths. I like that it's grassroots. We've had a really one successful example in my institution that I really thought is amazing with early career faculty. But despite what may seem more casual, formal agreements and ground rules are really important to maximize benefit. It does tend to be more holistic, caring, not just focused on academia and the career side. There's a growing use of social media as a networking mechanism for members of peer group. And this is an opportunity for allyship, which is another importantly emerging area for mentorship. I really like this paper. It came from a pediatric endocrinologist. Again, it was an effort to develop a professional organization to support women in academic medicine. So it's nice that it came from a pediatric subspecialty group. They formed a group called SWIMS, Supporting Women in Medical Sciences. And this is a publication just sharing their model and their learnings. They felt it's important to have identify a commonality of why you're getting together. Meet regularly. They actually met every 2 to 3 weeks in a private place. Options for good communications through multimodal mechanisms. They said 7 to 9 people is ideal. Limit the time, speaking time for each person. Define the roles for each meeting. So a different host should lead each discussion and define some behavioral expectations. Reflections on their model, they said it provides a safe and a structured space, integrated social media peer support. The ground rules of confidentiality and support allowed open, honest dialogue, and everybody appreciated the designated time for self-reflection. Their paper commented that there still remains an important place for formalized, establishment-based, hierarchical mentorship and support, but peer mentorship is increasingly recognized as having unique strengths. I would say that there's a great interest in physicians as leaders and multiple opportunities in your own organizations, your own professional societies, whatever limb of medicine you may be in, as shown by this cartoon. Effective leadership development does include an important component of mentoring. And I would say this has been another opportunity to think about career mentorship. I'm going to go through this one really quickly. I love this slide. As someone who belongs to the gray-haired community, I think there's awareness that there are significant generational differences and mentors need new models. And this is a really fun paper from the Department of Surgery in Michigan, looking at myths and realities. And maybe I'll just pull out a couple of them between millennials who might say that they're misunderstood. And why this is really important, as this paper turned out, is by 2025, 75% of the workforce will fit into the millennial generation. So it's time for change, as much as we may feel uncomfortable with that. Just to say, the millennials may be criticized as being impatient, and they see themselves as being efficient. They're accustomed to rapid information and distillation. Lazy versus balanced. They're motivated by purpose, organizational mission, and less skills of skill over time and rank or traditional metrics is less important to them. So I just won't go through all of these, but you might want to look at this paper. I think they're interested, I don't mean to use it generically, but there's been an interest in micro-mentoring, in other words, shorter periods of time, team mentorship. There's really a desire to find a collaboration, purpose, and advancement in their professional lives. And I think more than the generations behind them, perhaps they may be willing to pursue new opportunities if they're not fulfilled in the current description. So as a mother millennial, and my son is in healthcare, but not as a provider, I asked him what he thought about this, and he suggested, I think there's also a difference between millennials born in the 80s, who are career strivers, and those born in the 90s who are more purpose-driven. I know this is very provocative, but just sort of raise this as a healthy ground for discussion, doing a good job of this. So the last point is the role of our institutions. This is the harder mountain to move, and I think there's a lot of interest in this, but my first message is don't wait for someone else to do it for us. This paper, it was an invited commentary, developing a culture of mentorship to strengthen academic institutions. There's a growing body of literature, as I've sort of shared with you, on the positive impacts. It needs strong commitments from the top to nurture the next generation, as well as grassroots efforts to create mentorship opportunities. And she ends by suggesting that mentorship should be elevated to the level of a strategic priority. This was another, almost getting to the end here, but this was a survey done from Weill Cornell College with a research mentorship focus, but they surveyed 22 more senior faculty. They were at least average of 26 years post their highest degree, about what they've learned, what they might want to change. And this is a really interesting point. Needs to be more comprehensive institutional acknowledgement of the time, the service, and perhaps even thinking about it as a metric for promotion. Need formal plan to organize research mentoring, and they'd like some tangible support. I would again like to highlight this point. It was written by Buckner, the editor-in-chief of JAMA, that research mentorship or research sponsorship supervisory work is different than career mentorship. And oftentimes that research supervisor might not be the ideal person to be your career mentor. So let's dream big. It'd be nice to have a mentorship academy at our institution. I love this structure that the University of San Diego has developed, where I imagine that it's a culture of inclusivity, institutional support, training for mentors to do a better job, and bringing it into departments and divisions, and looking at some output to show that continuous cycle of improvement and growth. So I'll end with a quote. This is from a good friend, a colleague, Dennis Danman, who was a colleague at Sick Kids, and then he was a fellow Department of Pediatrics chair when I came to Canada. He did a project with a medical student, and they published this paper in the Canadian Medical Association Journal. And the mentor testimonial is, our mentorship project was a success because it was mentee initiated, open-ended, mutually respectful, and challenging. My payback is seeing the emergence of a young physician at the cusp of what will no doubt be a highly accomplished career in academic pediatrics. Oops, I think that is, oh, this is my last slide. Thanks to Michelle. So this is from the Archives of History, and our two Golden Cane Award recipients here, Alfie Fish, Blanche Chavers, and here I was as a fellow. So thank you, Michelle, for sharing this with me. And I know we had a busy agenda today, probably not any time for questions, but I'll end there.
Thank you so much for that great talk. And there may be some other folks you recognize in that photo as well.
I recognize all of them, but we just don't have time to. But yeah, there's a quiz for the people in the audience.
Yes.
Vintage, 83, 84.
And congratulations again to Blanche and Alfie.
If your slides were excellent, what a great compilation of resources. So if you're comfortable sharing them, we would certainly love to circulate them. And yeah, thank you for that great talk. I think gives all of us a lot to think about with our own mentoring program within our department.
Happy to share the slides. I kind of structured in that way as being PowerPoint failures, breaking every rule with too much information, but managed to recycle them and read them again and again. I'm happy to do that.
Wonderful. Well, thank you to everyone for being here. I love seeing the nephrologists from around the country chiming in, really underscoring the wonderful footprint that our two gold-headed cane recipients have had in their careers. And thanks to Dr. Eddy for joining us and sharing your wisdom. And of course, congratulations to Dr. Chavers and Dr. Fish for their incredible careers. So thank you, everyone. Have a wonderful rest of your day. Bye.
Thanks again for having me, and thanks again to Blanche and Alfie.